you're just going to keep your arm relaxed.
It was a measure that defined our pandemic approach, requiring workers in healthcare to be vaccinated against COVID-19 to protect those most vulnerable. And now, it's gone.
The things that makes people safer aren't the rules, they're the vaccines, and to make them available as widely as possible.
Health Minister Adrian Dix alongside Provincial Health Minister Dr. Bonnie Henry, like so many times before, announcing waning COVID numbers make the mandate no longer necessary. Instead, healthcare workers will be required to register their vaccination from COVID to flu to mumps, measles, and rubella.
I see this as the perfect opportunity, with the understanding of how important immunization has been in getting us through this worst crisis that we've ever faced, at least in our generation.
British Columbia, the last jurisdiction in this country with the mandate, and it's been like that for a while. The province says 2,692 workers were fired because they weren't vaccinated against COVID, including 630 full-time workers. This includes specifically in emergency rooms, 17 nurses in Interior Health, 23 in Fraser Health, and 7 in Northern Health.
All done.
Both the BC Conservatives and BC United have been calling for the mandate to be lifted.
What changed today that wasn't there yesterday or a month ago or a year ago that brought her to this decision? And the only conclusion I could come from is they made this decision because of politics.
In a statement, the BC Nurses Union says these nurses are a welcome addition that will help alleviate the critical staff challenges that are currently resulting in delays to patient care, adding to questions about why it took so long to lift the mandate.
It's just unfortunate that this government held out as the last jurisdiction in North America to keep punishing people for no good reason.